If you're over 60 or caring for someone in that age group, please give me just the first 2 minutes, because there's something I want to say, and I hope it's not too late. I'm a neurologist. For nearly 20 years, I've witnessed hundreds of stroke cases, many of them in people who seemed perfectly healthy, non-smokers, no diabetes. They exercised, ate their greens, and took their medications on time, but they still had strokes. And the most shocking reason why? It came down to one small thing. They didn't know about a simple 5-second action that could be done every day. Yes, just 5 seconds. It may sound strange, but it's something that's now being studied seriously, and I'll explain it to you right now. First, I need you to picture this. Every morning when you wake up, there's a moment when your blood pressure surges, suddenly. It happens when your body transitions from sleep to being awake, and it's the most dangerous moment of the day for your brain. It's called the morning blood pressure surge, and it's when the majority of silent strokes happen, especially in people over 60, when blood vessels are no longer as flexible as they used to be. Linda, a 67-year-old woman from Texas, once told me she walked every morning, ate clean, but one spring morning, just after stepping out of bed and taking a few steps, she felt dizzy, then collapsed. She had suffered a stroke. No warning, no headache, just a lightning strike in the early hours. And it took her 8 months of physical therapy before she could speak again. You know what haunts me the most? If Linda had known about that 5-second action, maybe that day could have gone very differently. So, what is this 5-second action? It's simply this. Sit up slowly and gently rub your ears and neck for 5 seconds before standing up from bed. This helps activate the parasympathetic nervous system, regulates your heart rate, and reduces the risk of a sudden blood pressure spike. It's like gently pressing the brakes before driving your body into a brand new day. A recent study from Kyoto University found that people who practice this every morning had 12% more stable blood pressure in the early hours, significantly reducing the risk of peak blood pressure and stroke. And that's just the beginning. We'll go deeper into this shortly. But first, let me ask you, when you got out of bed this morning, did you rise slowly, or did you get up right away? Did you notice if your heart was beating unusually fast? If you're not sure, then this video is for you. One of the things that makes strokes so dangerous isn't the pain. It's the fact that it often doesn't hurt. No noise, no warning. And that's why thousands of people every single day don't even get the chance to call for help. I remember very clearly a patient named Bill, 73 years old, living alone in Florida. He was a former police officer, tall, strong-looking, seemed healthy. His daughter told me that on the morning it happened, he didn't reply to her usual morning text. When a neighbor came to check in, he was lying on the living room floor, eyes open but unable to speak. He was paralyzed on one side and couldn't even reach his phone. It all happened just minutes after he got out of bed. Bill didn't know he was at high risk. He didn't have diabetes. He didn't smoke. But he did have something many people over 60 share: unusually high morning blood pressure. And like most older adults, when he got out of bed, he stood up quickly, went to the kitchen, and started his day without giving his body a moment to adjust. Do you see? The brain can suffer permanent damage in as little as 5 minutes without proper blood flow. That's why there's a phrase in medicine: time is brain. Every second of delay means thousands of brain cells are lost. The scariest part? We think that taking our blood pressure meds is enough. But medication alone can't replace what you do in the first 30 minutes of your day.
Here's something not often said out loud. Morning is the most dangerous time of day for older adults.
Why? Because right after waking, three things happen simultaneously. Cortisol spikes, blood vessels constrict, and your blood thickens. That's the body's natural way of waking up. But when your heart and circulation are weaker, your liver and kidneys are slower, and you haven't prepared for it, the risk goes way up. That's why I want you to understand this. Small changes in your morning routine can make a big difference. We've already talked about the 5-second action, gently rubbing your ears and neck before getting out of bed. Now I want you to picture a few more simple changes. There's a woman named Martha, 69, living in Denver. She used to feel a strange numbness on one side of her face whenever the weather turned cold. She didn't think much of it. Not until a checkup revealed she had experienced a transient ischemic attack, a mini-stroke. I asked her, "What do you usually do after waking up?" She said, "I get out of bed, take a cold shower, then drink coffee." She didn't know that cold water can cause sudden vessel constriction, especially on an empty stomach. And coffee, though beneficial in moderation, can raise heart rate and blood pressure when consumed first thing, before food. We don't need to give up coffee, but we do need to understand when to have it. After changing her routine, drinking a glass of warm water first, gently rubbing her neck, doing 3 minutes of breathing, having a few walnuts and a boiled egg before her coffee, Martha told me, "I didn't just feel more awake, I felt more in control of my body. And for the first time in years, I felt peace of mind." You see, what we need isn't fear, it's the right information. Just understanding this: morning is golden time for brain health, but also the most sensitive time for anyone over 60. Not because age is a sentence, but because your vascular, nervous, and hormonal systems slow down, and they need support, not from stronger pills, but from smarter actions. And if you're wondering right now, where do I begin? That answer is coming in the next part. There's one thing I've learned after more than 20 years working with older adults. Most people don't lack willpower. They simply lack a simple system. Nobody wants to live with the risk of stroke, but if the solution you offer requires remembering too many steps, spending too much money, or completely changing their lifestyle, they will give up. That's why what I share here doesn't come from textbooks. It comes from real life, from the elderly out there, those who've tried, who've stumbled, and who've seen real results when they got it right. I'm not going to tell you to hit the gym every day. I'm not asking you to meditate for an hour. I'm only asking you to start with 5 seconds. Like this: gently massage your earlobes, then slide down along the edge of your ears toward the side of your neck. Simple, right? But the effect is real. I explain to every patient, the ear, especially the earlobe and the area behind it, contains dozens of nerve reflex points. When you gently stimulate that area, it activates the parasympathetic nervous system. You don't need to remember that name. Just know this: it's the system that calms the body. It slows your heart rate, relaxes blood vessels, and naturally lowers blood pressure. And here's the miracle. When you do this right after waking, you help prevent that early morning physiological shock, a key cause of thousands of silent strokes. You might ask, is just rubbing my ears enough? The answer is, not by itself, but it's the perfect place to start. Because one small change can lead to a chain of others. I once met Mr. David, 66, in Seattle. He started by setting an alarm reminder to massage his ears before sitting up. Then he added a few deep breaths, then a glass of warm water, then 10 minutes of walking around his garden. Small steps, simple habits. Together, they formed a cardiovascular protection system. When I met him again 6 months later,
He said something I'll never forget. I don't just feel like I've avoided a stroke. I feel like I'm taking charge of my life. And that's exactly how I want you to feel. You don't need to do everything at once, but you need to start. Picture tomorrow morning. You open your eyes, and instead of jumping out of bed, you lie still and massage your ears for 5 seconds. Then you place your feet on the floor and take 3 deep breaths. Then you walk to the kitchen and drink a glass of warm water.
Less than 2 minutes. No tools, no cost. But you've just done 3 things: boosted your circulation, calmed your nervous system, supported your brain health. Science has shown people who practice morning deactivation habits have a 28% lower risk of stroke. You might not remember the numbers, but remember the feeling, being in control. You're not waiting on doctors, you're not relying on medication. You're taking your morning into your own hands, in a way your body will thank you for. And that is the true foundation of healthy living after 60. Not living longer in fear, but living clear-minded, flexible, and intentional with every action you take each day.
Someone once asked me, "Doctor, what can you really do in 5 seconds?" I understand. After years of living with blood pressure pills, cholesterol meds, maybe you've lost faith in the simple things. But the truth is, it doesn't take a long time to change your health. It takes the right action at the right time, done the right way. I want to share with you 4 actions, each taking only 5 seconds. But when done correctly and consistently, they help your nervous system, heart, and brain warm up like a well-oiled engine each morning. Everything runs more smoothly, no blockages, no sudden shocks. First, stroking the ears to activate brain circulation. Let me tell you about Janet, 69, from Florida. She used to feel dizzy every morning when standing up. After nearly falling in the bathroom one day, she started trying the ear stroking method I shared during a seminar. Just using 2 fingers to gently press and stroke down the ear limb to the earlobe twice on each side. After 2 weeks, she messaged me. "Not only am I standing up more steadily, I'm sleeping better." When I asked why, she smiled, "Because I'm no longer afraid of falling." See, feeling safe is the first step toward feeling happy. And it starts with something small, 5 seconds of ear massage each morning. Second, place your hand over your heart to remind your body to stay calm. This may sound emotional, but science backs it clearly. When you place your hand on your chest, the nerves and skin in that area stimulate the parasympathetic system, the part that slows the heart and lowers blood pressure. All you need to do is rest your hand on your chest, close your eyes, and take 1 deep breath, 5 seconds. Enough to reset your body after sleep, the time when stroke risk is highest. A gentleman named Frank, 73, once told me, "I don't know if it's science or not, but when I do that every morning, I just feel more at peace." And to me, that sense of peace is just as important as blood pressure readings.
Third, rubbing the soles of your feet to wake up your peripheral circulation. This one is rarely talked about, but it's incredibly important for older adults. When you sit up and put your feet on the floor, don't stand right away. Take 5 seconds to gently rub the center of your sole, that soft area between heel and toes. This boosts blood flow to the lower limbs, helping prevent dizziness, numbness, or sudden falls from blood pressure drops. Eleanor, 76, a retired nurse, told me, "Rubbing my feet each morning helps me stand up smoothly. No more lightheadedness." A simple action, but for seniors, it can be the difference between standing steady and falling hard. Fourth, exhale longer than you inhale to reset your biological rhythm. Most people don't realize the way you breathe affects your blood pressure. When you inhale, your heart rate increases. When you exhale,
it slows down. So when you exhale longer than you inhale, you're sending a signal to your body. You're safe. Relax. I recommend people do 3 to 4 slow breaths each morning. Inhale for 3 seconds, exhale for 5 seconds. Just 20 seconds total, 5 seconds per breath. That's enough to relax your blood vessels and ease pressure on your heart. A veteran named Paul, 71, once said he felt mentally clearer after a few mornings of this breathing. He said, "I don't dread mornings anymore. It feels like I'm steering the day, not being dragged by it," he told me. And finally, a positive affirmation to guide the mind toward light. I know this may not sound medical, but psychiatric research shows seniors who repeat a positive phrase each morning have significantly lower cortisol, the stress hormone. And you already know, chronic stress is a silent trigger for strokes. You don't have to shout it. Just place your hand on your chest, close your eyes, and whisper, "Today I choose peace." Or, "My body heals with kindness." Just 5 seconds, but it sends a powerful signal to your nervous system, your heart, and even the vessels in your brain. You are safe. Do you see the pattern here? None of these actions require medical devices. None cost money. None are complicated. Each one takes just 5 seconds, focused on a small part of your body with a clear, intentional purpose. And when you repeat these small actions every morning, they form a system, a shield that protects your blood vessels from spikes in pressure, from clots, from sudden strokes when no one's around. It's not magic. It's the right habits repeated enough that create real change. There's one thing you'll often hear me repeat over and over again in the clinic. Science only matters when it can be applied in daily life. Everything I shared earlier would be meaningless if you can't turn it into a habit. Right in your own home, with your own body, in your current rhythm of life. So, how did I help my patients, those in their 60s, 70s, even 80s, actually follow through? I started with one A4 sheet of paper. On it, I wrote in bold, just 5 seconds each morning, by hand. Then I listed the 5 actions I mentioned before. Simple, no medical terms, no jargon. Just stroke your ears, place your hand on your chest, rub your feet, breathe deeply, say something kind. That's it. I told them to stick that sheet where they'd see it first, by the bathroom mirror, the nightstand, or the refrigerator door. Location matters more than you think, because it reminds you when your brain is still waking up. Next, I told them, you don't need to do it perfectly. You just need to do it. One gentleman named Henry, 74, told me at first he only remembered to stroke his ears and rub his feet. But after 2 weeks, he was doing all 5, without thinking. "It's like brushing my teeth," he said. "If I don't do it, something feels missing." What I notice clearly is this. The people who stick with these habits are the ones who connect them to an emotional reason. Some do it because they don't want their children to worry. Some do it because they once survived a stroke and never want to go through that again. And some, like Ellen, 68, do it because I want to live without depending on anyone. I want to stay sharp. So, if you're still reading this, take 10 seconds now and ask yourself, how do I want to live the next 10 years? Free or dependent? Then turn that answer into your reason to stick with your 5-second morning habit. One extra tip, not required, but helpful, is to write down how you feel each morning. Just a few words. More alert, less headache, no dizziness, or simply, I feel like I'm in control of my day. Jotting this down helps your brain recognize progress, and strengthens your belief in what you're doing. Doctors don't just prescribe pills. A good doctor also prescribes belief. And I hope that, no matter your age, you feel a bit of that through what I've shared with you today. Do you remember what I said at the beginning about shrimp? If you're over 60 and believe shrimp is safe, you need to hear this. That wasn't just an opening line, it was a wake-up call. Because sometimes what we believe to be right is exactly what puts us in the most danger. Now let's look back, not with fear, but with clarity. You're now equipped with information. You know what to eat, what to avoid. You have a 5-second routine that costs nothing and requires no medication. And you've seen it with your own eyes. People like Henry, Ellen, or the 72-year-old veteran in Arizona, they're no different from you. They simply started. Many people have felt angry when they realized they were misled by advice like eat clean or seafood is healthy. But instead of blame, now you can act. You can be the first in your family to take control. You can help your partner wake up with less joint pain. You can share this with your brother, the one who still thinks high blood pressure is just part of aging. I'm not asking you to do everything at once. I'm just asking you to pause every morning. Place your hand over your heart, take a slow breath, and ask yourself, am I living intentionally today, or just letting life happen to me? Leave a comment under this video. I'd love to know, what kind of seafood do you eat most often? And what surprised you most in today's video? I read every comment, not for algorithms, but because I truly believe this. Every story shared is a reminder that someone else doesn't have to walk this path alone.
If there's someone you care about, over 60, taking blood pressure medication, has experienced dizziness, or is simply looking for a healthier way to live, please send them this video. One click, one new conversation, one change begins. If you live with your parents, grandparents, or even an elderly neighbor who's grown old alongside the years, print out the list of 4 seafoods to avoid and 4 to include. Stick it on the fridge. Place it on the dining table. Turn your care into concrete action. And if today you've learned something that makes you want to try again, even something as simple as drinking a glass of warm water in the morning, please share that in the comments. Your story could be the first light for someone else who is still tired, still uncertain. I read every line you write, because I believe change doesn't start with knowledge. It starts with connection. And you are the one who lights that spark.